those of you who have never listened to Dr. Paul Clayton, he is the head of our scientific advisory board in Cincinnati, and he's a pioneer when it comes to study the pharmacological effects that food and botanical ingredients have on our body, and how it can help your health and your physical performance. So that's why I'm so happy that he could join us tonight, talking about a very important topic, and that's gut health. So Dr. Paul, please tell us about why is it so important to look at our gut health nowadays? What has happened the last couple of years, and why is there so many people having problems with their gut health, and what can we do about it?
Okay, well, there's no doubt that the numbers of people with IBS and IBD have increased dramatically over the last half century or so. And we've also seen a huge increase in a closely related condition of NAFLD, non-alcohol related fatty liver disease, which now affects, I think it's an astonishing, a quarter of the entire world's population. I mean, this is really, really huge. And the scale of the problem is so vast that it's outstrips the abilities of healthcare systems anywhere to actually put remedial measures in place. So the drugs that are currently used, the surgical techniques that are currently used are not particularly effective. They're certainly not cost effective. And I think it's really critical now that we take a long and sustained look at what it is in our diet and lifestyle that is creating this set of problems. And we have to take steps to neutralize those elements in the modern lifestyle that are damaging us so badly. Now, one of the pioneers in this area is a man whose name you may have heard me mention before, Barry Popkin. And Barry is, he's not a medical scientist, he's an agricultural economist based in, I think, the North Carolina population center of all places. I'd have to check on that. I'm not completely sure about that. He may not be there anymore. But almost 20 years ago now, perhaps even 25 years ago, he published the first of a series of papers on what he called nutrition transition. And what he meant by that was a pattern that we've seen repeated everywhere, all over the world, that when countries leave their traditional diets behind and move to the modern and increasingly ultra-processed diet, we see a huge increase in the numbers of people affected by non-communicable diseases. So this is not just about the gut, it's about heart disease and dementia and liver disease and autoimmune disease. I mean, everything. We're getting sick in so many different ways. Now, these are not new diseases, they've always been with us, but we're now seeing them in vastly increased numbers. And we're seeing them increasing in progressively younger groups of patients. Now, IBS and IBD are a part of all of that. And Barry is not a pharmacologist, and so he hasn't really looked, as far as I know, at the way in which the modern diet and lifestyle is harming us. That's really been my area of interest. And it's become clear, I think, that we can move on from Barry's rather romantic idea and look at something in a more, take a more nuanced and detailed approach. We can start to identify what it is in the modern diet and lifestyle that makes us ill. And then from that starting point, we can begin to create very specific antidotes to what these problems are. So we've got to the point, I think, where we can identify 4 key drivers of the modern tides of disease. And they are chronic inflammatory stress, which the modern diet causes, type B malnutrition, which is caused by the modern diet, dysbiosis, and now we're coming back to the gut, which is caused by the modern diet, and a huge imbalance between the amounts of carbohydrates and specifically sugars we're eating, and our ability to utilize those sugars, which is very much tied up to the levels of physical exercise that we go in for. So we can now devise strategies to neutralize each of these four bringers of death and destruction. And if we focus on the gut, probably the most important of the four there is dysbiosis, which is an imbalance of the different microbial species that normally inhabit the large bowel. We traditionally used to eat a diet consisting of basic produce. And when you look at that diet, it has a higher nutritional density, a lower calorie density, but in terms of the gut, it has a much wider range and much larger amounts of prebiotic fibers than you find in the modern ultra-processed diet. Now, if you're eating a pre-transitional diet with lots of these lovely prebiotic fibers, they are foods, nutrients, not specifically for you, but indirectly, but directly for a group of microorganisms that live in the large bowel, which we think of as probiotic species, and which are predominantly gram-positive. When they have a chance to get access to these fibers, they'll break them down, they'll use them as their preferred food, which is why these bacteria tend to live in the lumen of the gut. And they break them down into some very interesting compounds, which we call postbiotics. And one of the most interesting of those is a series of short-chain fatty acids, including butyric acid. Now, butyrate is really important because it is a preferred fuel for the colonocytes, the cells that line the large bowel, and it is also a powerful anti-inflammatory compound, and it is also really, really good at telling the cells that line the gut to not be cancerous. In fact, it's good at killing cancer cells and persuading others to stop being cancerous and start being normal. Here's the problem. Since we moved to the ultra-processed diet, our intake of these fibers has declined really dramatically, so that the average intakes now are probably less than half of what we think the minimum healthy amount is. So your probiotic species, your own probiotic species, have dwindled. They're much reduced in numbers. They are replaced by a host of other microbes, many of which are gram-negative. And guess what? These species like to eat, many of them, they like to eat mucin, which is a key component in the mucosal layers that lay over the walls of the colon and protect it. So now these bacteria are damaging the mucosal layers. They're coming into direct contact with our cells, the colonocytes. And because they're gram-negative, they're coated with a substance, a waxy substance called lipopolysaccharide, which is hugely pro-inflammatory. So now this conversation between the microbiome and ourselves is no longer calming and anti-inflammatory and chemoprotective. It is pro-inflammatory. It is actually telling our cells, go on, be cancerous and be irritated and develop a leaky gut at the same time. Why don't you? And a whole host of problems spin off from that. So the logical response, the logical way to neutralize the damage that is caused by the modern diet through the microbiome is to restore levels of prebiotic fiber to what was consumed before the transition. And this is what we do with Xenobiotic. Very importantly, we don't use a single prebiotic fiber. We use a range of prebiotic fibers, and the amounts and the types of each of them have been very carefully calculated. It was actually an insanely complex calculation. We amazingly got it right the first time, which I didn't expect. And as many of you know, you have in this time-release blend of prebiotic fibers something that actually tastes quite pleasant. You can just spoon it from the tub right into your mouth if you want. It's got this mild sweet taste. Or you can mix it into soups or stews or yogurts, or you can cook it into breads and biscuits. Doesn't matter. And when you eat that, it nourishes and supports the growth of your own probiotics right throughout the length of the large bowel. This is hugely important, and it neutralizes one of the 4 key ways in which the modern diet and lifestyle harms us. Is anybody still there? Or? Am I talking into a void? Hello? Hello, Viveka?
Hi, I will just try to, do you want people to ask question? I can unmute. I have muted everyone, you know.
Oh, well, I mean, perhaps you shouldn't mute yourself, because for a moment I thought you'd all walked away and left me in a vacuum.
Absolutely not.
And because I wanted to sort of get across, you know, the outlines of our story,
Yeah.
and then perhaps throw it open for very specific questions, which I'll try to answer. I mean, that's what I've given you is really the theoretical underpinning for xenobiotic. And I mean, I would be interested to hear from people who've used it, what their experiences have been, and from anyone else who's perhaps theoretically inclined and who's interested in the mechanism of action, the pharmacology.
We have some questions, I know. Perhaps Ruth, you can ask your questions. Yeah, if you can see in the chat.
Yes, okay, I can see. Do I know about the impact of the latest vaccinations on gut health? I don't know. Well, first of all, I think it's we need to find a better way to talk about these immunization programs, because they're not the standard types of vaccination. It's not classical immunization. These are, in my view, experimental vaccines. And given that the case fatality rate of COVID is absolutely minimal, unless you are geriatric and or have serious comorbidity, to me, the way in which governments have rolled out these programs, for which there is still no adequate long-term safety data, is a grotesque breach of the Hippocratic Oath. And I don't think that it can be justified in terms of risks and benefits. The therapeutic ratio is unknowable, but we do know that there are very serious side effects associated with some of these mRNA products, which I think are better regarded as gene therapies rather than classic immunizations. And as for the long-term adverse effects, it's going to be a while before we know what they are, if any. But if there are any, the huge scale, the rollout of these programs is going to make this a very serious problem in the years to, could make it a very serious problem in the years to come. So what effect does it have on the microbiome? I don't know if these mRNA products have effects on the microbiome. What I do know is that there is emerging evidence that if you have dysbiosis, it does make you more vulnerable to COVID infection. The COVID virus, there does seem to be a port of entry into the body, in the gut. And it does seem that if you have chronic inflammatory stress and an impaired gut barrier function, then you are more likely to have a serious infection. Now, this is based on a relatively, I think it's only 2 or 3 published papers that I've seen so far. It sort of fits with how I think the role of the microbiome, what it actually is. It makes sense to me. And I think that one of the points that is really interesting is that, having spoken to many of the Xeno leaders, and I know that head office has done the same thing, amongst all of the very, very many people who are on the health protocol and who have developed COVID, there have been no deaths, not one single death. Now, I cannot say that this is hard and fast proof of anything at all, because this has not been conducted within the framework of an RCT. This is simply observational, but it very much fits in with what I believe to be the really critical roles of the innate immune system, and the microbiome is a part of that, in protecting us against infection, not just COVID, by the way, but against a very, very wide range of other infections also. Okay, so do you think this is the prebiotic would help reduce symptoms that come about from allergies to gluten and lactose? If you genuinely have a problem with gluten, if you have celiac disease, diagnosed celiac disease, then I do not think that the prebiotics are going to modify that very much. You will still have to avoid gluten. If you have lactose intolerance and it has been proven, specifically diagnosed, I don't think that the prebiotics will help with that either. However, there's a lot of self-diagnosis of these conditions, and there are undoubtedly many people who believe genuinely that they have celiac disease or gluten sensitivity or lactose intolerance who don't, but do in fact have a problem that is more associated with chronic dysbiosis. And in those people, by taking a blended prebiotic supplement, I would expect to see improvement of symptoms. So the next question, what are your thoughts on parasite protocols? Would there be the need to use probiotics? Okay, the parasite protocols, there are various of these, and there are a range of actually reasonably effective anti-infective drugs that are routinely used both in humans and in domestic animals, and they have a role to play. I would not regard xenobiotic as an anti-parasite compound. I don't think that would be an appropriate way to look at it at all. I do think that by establishing a healthy microbiome, which xenobiotic is designed to do, it does reduce the risk of gut-associated infections. So things like food poisoning, for example. We know that the pathogenic microorganisms involved in many of those types of infections, if you have a healthy microbiome and you're feeding it with the right prebiotic fibers, then your probiotic species produce actually a very wide range of compounds, which you can think of as a kind of chemical warfare situation, which they use to keep down the numbers of potential pathogens. You feed the probiotic species and they will pay you back. And they will pay you back by bringing other potentially pathogenic microorganisms under control, by reducing their numbers, by reducing the areas in the gut where they can live and breed. So I think of this as really supporting, amongst other things, a very key component of your innate immune system. Would you ever need to use probiotics as well as xenobiotic? I actually don't think so. The problem with the probiotics in alt med circles and in some medical circles too, there are so many strains, so many substrains. There are limited amounts of data to support the use of some of them for certain very specific indications. But the thing is this, if you're going to take a probiotic which has been grown exogenously under optimal conditions in a stainless steel vat somewhere under a Swiss mountaintop, yes, these microbes are differentiated. We know some of the things that they do, but first of all, it's hard to deliver them to the right place. You have to manage gastric transit. You have to make sure they actually get to the large bowel. And in order to do that, you have to microencapsulate, you have to sporulate, things like that. And it's even using those techniques, it's not always clear that the commercially used products deliver the right amounts of the right microbes to the right place. And even if they do, the numbers of microbes or colony forming units are very, very small in comparison to the much larger numbers of microbes that already exist in the large bowel and know that environment and know how to fight for their place in it. And this is one reason why after using a probiotic, the day after finishing your course of probiotics, you won't find anything. It's all gone. There's nothing there left in the stool. It's gone because they don't take. I prefer to support the growth and the health of your endogenous probiotic species. They may be small in number, they may be having a difficult time, but they're clinging on, they're holding on in there, and they know the terrain. Give them what they need, and they will do the job for you. What is your view on digestive enzymes and how to support digestion? I think they may have a role under certain conditions. If you have diagnosed exogenous pancreatic insufficiency, then I think that clearly there is a role. For most other people, I'm not necessarily convinced. What are the thoughts on infrequency of intestinal cleanses? I simply don't believe in them. If you have the right microbiome, you don't need them. If you're eating the right microbiome and a certain amount and an adequate amounts of non-digestible, non-fermentable carbohydrates, so things like celluloses, lignins, hemolignins, then you won't need regular cleanses at all. If you're eating a postmodern diet, of course, then there is perhaps a rationale for them. But to be honest, I don't know enough about them. It's not an area that I've studied, and I don't think I'm the right person to issue guidelines or make recommendations on this score. Links to depression and gut health. Clearly, they exist. If you have chronic inflammatory stress anywhere in the body, we know that the inflammatory mediators that are released into the bloodstream do adversely affect affect. So you don't necessarily feel particularly good. And there's a group of really good researchers at the University of Cork who have developed various strains of probiotics that they call psychobiotics. And they do have some evidence that shows that if you eat your yogurt in the morning containing these species, that it can help to improve mood. However, I go back to my point that I think prebiotics are the way to go. They don't have a shelf life problem. You can cook with them. They're infinitely stable. They're intrinsically less expensive. And guess what? Recently, we've seen some studies coming out that say prebiotics have exactly the same end result. They also improve your mood and the way you generally feel. We go back to Hippocrates, who said that all illnesses start in the gut. Well, he said a lot of things, and actually he railed that back, and he said, well, maybe they don't all start in the gut. And then he said things like, the cure to all illnesses by taking a walk. And if you feel depressed, go for a walk. And if you still feel depressed, when you come back from your walk, go for another. I mean, Hippocrates had all kinds of ideas, and some of which I think, there's a lot of, good sense and substance to. But it isn't just all about the gut. And it certainly isn't all about taking probiotics. Depression and gut health. Are the long-term diseases linked to inflammation in the gut? So you're talking now about long-term gut problems like Crohn's and ulcerative colitis. Is that what you were talking about? If so, yes, there is a clear relationship between dysbiosis and these inflammatory disorders. Having said that, I don't necessarily recommend that you use xenobiotic to try and treat these conditions, because if you've gotten to this point where you have an unhealthy microbiome and you've got chronic inflammatory stress going on, you still have a relatively stable population of microbes. And if you start changing it, and you will change it in a big way by using xenobiotics, then you're going to go through a very uncomfortable transition. And so what I would generally suggest is that you use balance oil for 3 to 4 months, get the 6:3 ratio down, damp inflammation in the inner walls of the intestinal tract, and then start using xenobiotic in small and gradually increasing doses. So take it easy. These patients have a very complex and unstable situation. And if you start to change it, don't try to do it all at once. Do it in progressive stages. How young can you give a child xenobiotic? Well, if you go back to the pre-transitional situation where we were all eating basic produce, children were eating after weaning, of course, were already consuming significant amounts of prebiotic fiber. And in fact, we have rather complicated ways of deriving information about the amount of calories people were obtaining from prebiotic fibers in different cultures. And some Mesoamerican cultures have been identified where it appears that they derived almost 30% of all of their calories from prebiotic fiber. So their children would have been eating very large amounts of prebiotic fiber right from the get-go. It would have been a very windy culture, but from everything that I've seen, I don't believe that there would be any serious adverse effects associated with this, and in fact, to the contrary. Reading about links to infertility and gut health. Oh, that is such a hot topic right now. There are some Australian researchers who've been looking at this. They started drilling into this about 10 years ago, And there clearly is a relationship between dysbiosis and infertility. And just by coincidence, in the next 48 hours, the blog post that I'm bringing out next is going to look at exactly this. So for any of you who are interested, if you visit my blog, and I think the post title is Stony Ground, which is, I'm sure you'll know, it's a biblical reference. Not that I'm necessarily a deeply religious person. And you'll see that I've cited some of the key research that has gone into this very topic. I have a customer who was advised by her naturopath that she doesn't need to take the xenobiotic because she already eats enough fiber. Well, I have no idea what this naturopath means because there's so many different types of fibers. There's at least 6 types, and then there's subtypes, and you may be eating enough of one type of fiber, but not enough of the prebiotic fibers. So I suspect that this naturopath doesn't really know enough about what the roles of these different fibers are, and may not be in a position to make a really informed judgment about this. If whoever it is listening, then you could suggest to this naturopath that they take a look at some of the stuff that I've published, or just dive into the more extensive literature on PubMed and do a little search on prebiotics and microbial shift, and then come back and have another conversation, because from what I read here, it doesn't look as if they really understand what they're talking about. Can you ever have enough or even too much dietary fiber from just eating fruits and veg? Well, the worst thing about eating too much dietary fiber is, it'll give you diarrhea if you really, really overdose. And that's about the only thing that's going to go wrong. So it's kind of self-limiting. You'll know yourself when you've had too much and you can start to cut down. I don't think that's a major issue. Some customers seem to feel improvement of gut issues when starting Protect. Is there a link? Yeah, maybe there is a link. And here is the link. It depends. If you've got a customer who's taking 6 or 8 capsules of Protect, and we know some people do, you can only, the way in which you take up the particles of beta-glucans, 1316 beta-glucans from Protect is very, very specific. It's not absorption. It's a mechanism which is called pinocytosis. So these are M cells in the Peyer's patches of the small intestine, and their role is to sample the contents of the intestine. And they're just picking up very, very small amounts of the contents. And if they see these yeast particles in there, they will break them down and use them to prime other components of the innate immune system, which is why these beta-glucans are so important. But they can only take up a very small amount. So if you're eating a lot of Protect, then most of it will pass into the large bowel. And when it does, the 1316 beta-glucans have a different effect. They then become a prebiotic, a bit like 1,4 beta-glucans. So yes, if you're eating a lot of Protect, you are actually adding a prebiotic fiber to your regime. I don't think it's the best way of doing it, but there is the possible mechanism. And then from Natalie, a new client who has had an operation after ulcerative colitis, would the prebiotics and oils help beforehand if you'd taken them? Well, the answer is I think they probably would. Will it help him now? It depends how much of his colon is left. If most of the colon, or in some cases you see that all of the colon has been removed, at that point xenobiotic isn't going to do anything, I'm afraid. Balanced oil will still be helpful, of course. Does he need to consult the doctor? I've only met him in the past few months. I think that the key question is how much of the colon is left, how much has been resected. If there's still a significant amount of it left, then the xenobiotic probably is going to be helpful. If he's lost more than 50%, then it may be more effective, it may be more useful for this person to use inulin, just pure inulin. Now, inulin itself contains a range of lengths of molecule. So it has a bit of this time release functionality built into it. But what it doesn't have are the resistant starches, which are the really slow fermenters and which only start to come into their own in a major way in the descending colon. Now, if the descending colon is gone, the resistant starch is wasted, and the inulin may be enough for this person. So I think those are all the questions I see in the chat box, unless anybody else wants to, has any other issue they'd like to address, they'd like me to address.
I know that there was added some new prebiotics to the xenobiotic we have today. What other effect can we expect that were in the xenobiotic we used before?
I think that the functionality is going to be pretty similar. Theoretically, it may be a little bit better, but I don't think many people will notice it.
And also many times people ask about the dosage, and also some says that if you eat it together with food, you can actually get the insulin level down. Is that right?
Well, yes, you can, because what these prebiotic fibers do is they increase the viscosity of the contents of the small intestine. And that has an effect on the rate of absorption of glucose in the small intestine. So by slowing that down, you reduce spiking of glucose in the postprandial situation. And that is considered to be a healthy thing to do.
And that's really exciting because many people have these insulin peaks, which can give a lot of other health issues.
Yes, and this is in fact one of the areas where gut health starts to interact with liver health, because the shape of your microbiome has a huge effect on liver function and your risk or otherwise of developing NEFLD, NASH, and then at the end of that chain, hepatocellular carcinoma. We know that there's a huge amount of underdiagnosis of these conditions, because I know that people think, well, if you have NEFLD, we can pick that up because you're going to be really overweight. Yep, if you are seriously overweight and you have type 2 diabetes, you have NEFLD, almost certainly. But there's a substantial number of people who have what is called lean NEFLD. So they are in with normal weight range, but they have NEFLD. And that seems to be about, as opposed to 25% of the population, is probably 5%. Still big numbers. And you don't want to have NEFLD. And I'm writing a post right now about the ways in which we can protect ourselves and prevent these conditions from becoming clinically important. Xenobiotic will play a part in that. Physical exercise is important. Carbohydrate restriction is important. It turns out that the omega-3s and extra virgin olive oil are protective. And of course,
Wow.
we have that in balance oil.
Yeah.
And then there are some very interesting herbal extracts, which are very clearly protective as well, and are now being increasingly widely used in China to protect against NEFLD and its sequelae. And all of these, we're working with all of these. They're all part of our health protocol, or will be part of the extended health protocol, which we'll probably move to by around the end of the year.
That's really exciting, but I need to stop you from telling us that.
I'm not going to tell you anything more.
Yeah.
Oh, Paul, it's Margie. I'm excited to see your next blog, because I was just sharing with the group last week, in the IVF patients, we're using both the balance oil and the prebiotic fiber, and seeing increased endometrial thickening, which the doctors have been amazed at. So
use Extend as well, because a lot of these patients will have type B malnutrition. I think if you use all three, what I've found is that in couples, actually it's a long history of infertility, they start getting through pregnancy and successful childbirth quite quickly. I mean, if you have other issues like PCOS, then obviously you have to do other things. You have to address that as well. But again, that's something that I touch on in the post, which comes out either tomorrow or the day after that.
Great. I look forward to reading that one.
We're
waiting to get Extend here. We don't have Extend in Australia, but that's okay.
Oh,
yet. It's coming.
I'm
Yeah.
really happy to hear that there are people out there who read the blog, because I never get to see who the readers are. I don't know how many there are. And it's like putting messages into bottles and throwing them out into the ocean. I've no idea who's looking at them, or if anyone looks at them. So whenever I hear that someone is actually reading them, and that's great, that's good news.
We will post your
You know.
link to your blog again now after this call.
Oh, okay.
So all
Okay.
the new ones also can follow you, because there are so many amazing and interesting articles that you post, so which give us more insight in what we are working with.
Well, it's what I do for Zinzino is actually very, very limited, because obviously we're known for certain things. We can only progress very slowly. But I mean, Viveka, if you know from what I write, the things that I talk about, that my areas of interest are much more extensive. And it's a kind of forward radar. There are some things there that I think we will eventually bring into the company when the time is right.
Paul, are you ready to do the 2 last questions? Do you have time for that?
Yeah, of course. For you, Viveka,
Yes.
of course.
Oh, so it's the xenobiotic helpful for a child who has recently been on a course of antibiotics?
Yes, absolutely, yes. And then the last question, how long after someone has finished chemotherapy can they start to take balance oil and zinc biotic? Okay, I would say that for anyone who's receiving chemo, you should take xenobiotic all the way through. Because one of the things that chemo does is it's really, really bad for the cells that line the gut, because they're turning over so rapidly. And so very typically, you will have all kinds of gut problems, all the way through from rawness in the mouth and the throat to nausea and diarrhea and all kinds of gut problems. Taking xenobiotic will help to reduce those, and it will not reduce the impact of the chemotherapy. So there is no contraindication there. There is no interaction. The effect of xenobiotic will just be protective. I would say also that for anyone taking chemo, or indeed anyone receiving radio, it's a very, very good idea to use Protect, because Protect will help the bone marrow to rebound more quickly. Any degree of bone marrow suppression leaves you immunocompromised and opens the window to an infection, which, if you're deeply immunocompromised, is going to be very serious. So by maintaining an intake of these 1,3,1,6 beta-glucans, there is really good data coming from the United States that shows that your white blood cell counts will come back to normal more quickly once the cancer therapy has stopped, and thereby you're reducing the duration of that window of vulnerability. That is something everybody should do. Balance oil is something that a lot of oncologists worry about. I don't think they should. I mean, in my experience, balance oil actually works quite well with a lot of different types of chemo and radiotherapy, but obviously we don't want to interfere with the relationship that exists between patients and their medical teams. That would only cause problems. And so I would say, stop taking balance oil when you go into the hospital, and start taking it once they let you out again. And if you're concerned and you want to know what they think about it, don't say to them, well, I'm going to be drinking fish oil. Just say to them, well, I'm thinking about eating salmon 3 times a week, which is the same thing. And for some obscure reason, doctors don't find that nearly as alarming. It's a puzzle.
It's strange.
And the same thing with Extend. I know that some oncologists are concerned about that because of some of the B vitamins, and the B vitamins are necessary for rapidly growing cells, which will include some of the cancer cells. Some of the early anti-cancer drugs were folate competitors. But if you look at the overall composition of Extend, I think that it is protective, because there are many other compounds in Extend which have the ability to induce apoptosis, redifferentiation, and mid-cell cycle arrest. And these are all very protective effects. Having said that, I won't go to the mat on this because, you know, I can't quantify it. That's just my gut feeling. So if I were to be diagnosed with cancer, first of all, I probably wouldn't go for cancer treatment anyway. I regard most of it as absolutely barbaric. And, you know, in 25, 50 years time, we'll look back on it and think how incredible, how medieval it all was. I mean, even the biologicals that are now in wide use, the range of side effects is absolutely dizzying. And this is something I've written another post on. So if you watch this space, and over the next 3 or 4 weeks, you'll see that I'm addressing actually a lot of these issues. And this is one of those areas where nutritional science and life science and politics and money absolutely collide. So you'll see in my posts that I do tend to move from science to politics and back again quite a lot. And some of you may find that offensive, and you're absolutely your right to do so. Others of you may think that I have some kind of a point. I am always interested in hearing what people have to think, what they have to say.
Thank you so much, Dr. Paul. And as always, very valuable information, very interesting to listen to you. And I know we could sit here for hours asking you questions, but I hope we can ask you another time to join us on the call and talk about another topic. I know a lot of people want to know more about how to protect themselves when it comes to the immune system. And then we also have many people wanting to know more about what to do to help the children to develop and grow and give them the right nutrition. So that's topics that I know that this group is really interested to know more about. So I hope we can ask you again.
Well, that's a topic that's really close to my heart. And if you look at the current post, that is all about the spectrum disorders. And from this perspective, I think you can see that if you're interested in child nutrition and child health and normal growth, you have to start before birth. You really have to start with maternal health and nutrition. And we can have a conversation about that, starting with maternal health and nutrition and extending through into pediatric health as well. My expertise is limited, especially in terms of pediatric health, but there may be 1 or 2 things I could add.
I know you can add great value to that as well, Paul. So
I hope so.
I know you can. So thank you so much again. We are really happy that you joined us tonight, and have a nice afternoon and evening in Miami. Go for a walk, get some fresh air and sun. And greetings to Madeline.
Well, always nice to see you, and I look forward to meeting with you again.
Me too. Take care, everyone.
Thank you.